that in the parity of telemedicine, we recognize that it is an important tool for us to use not only in this time, but in the future, and that we would find not only parity in terms of how we use it, mental and behavioral health as long as physical health, but also the platforms that are being used, irregardless to if it is, a PC, a Mac, an iPad, or even a smartphone, or even a regular phone in which people, a non-smartphone, that people can talk to their provider and tell them what the issues are, and making sure that the rates that are there, and that's not a conversation for today, but there's parity in the rates, as well as private insurance, Medicaid, and then also PMAP, which is is the way in which we work with our insurance providers through Medicaid. So there is, I think, some work to be done to ensure that there is parity in the payments. We think that this is a potential game changer, especially in low-income communities. Mr. President, I did just want to make a couple of comments, especially in light of Senator Abeler's passionate plea of opening up main streets throughout Minnesota. And I find it somewhat ironic. Senator Abeler knows this, that my mother-in-law lives in Anoka, in Senator Abeler's district, not far from Main Street, Anoka. And my mother-in-law, and she would tell you, and she's watching right now, we weren't able to spend Easter with my mother-in-law. My kids affectionately call her Mama, because my 18 and 23-year-old children, as long as myself and my wife, we all could potentially be carriers, and she is in a position in which she wouldn't do well if she got the disease. None of us would. But we especially think about my wife, who works each and every day running a treatment center with very vulnerable people. And though they have the protocols and things are seeming to go well, we don't want to make the chance. And then I'm in here today with all of you. And we interact with each other a lot, and we didn't want Mama to catch it. And then, of course, my very healthy 23 and 18-year-old children that I'm very proud of. Certainly listening to all of our physicians here, they could be asymptomatic, and so at Easter we didn't want to give Mama the disease. And so she lives 4 blocks from Main Street, Anoka. And so as we think about, and as the governor is walking through looking at the data and is working with the Department of Economic Development on how the trend will go and when we can start opening up businesses, and as businesses apply to open up and figure out what is the best way and what are the best practices, I want us to think about my mother-in-law, which we affectionately call Mama, to make sure that we're not putting her in a position, and her neighbors, and she's lived there most of her life, and her 90-year-old neighbor who she helps each and every day, and all of the others that are there, that we're not putting them in harm's way. And we're not putting them in a way that is going to affect them. And so though I can appreciate, and I've been on Main Street, Anoka, many a days. I spend a lot of time out there if we're not bringing her groceries or spending time with her. So I appreciate the passionate plea, but I would hope that it doesn't come at the expense of Mama.